As COVID-19 sucks up medical resources, people with HIV feel deprived of care. On World AIDS Day, activists say a prolonged pandemic is deepening the inequalities that have long driven the HIV epidemic. The medical care, the financing in the HIV sector, all that no longer exists. What needs to be done to fight both COVID-19 and HIV? Welcome to your COVID-19 special. I'm Chris Colbert in Berlin. While much of the world has been focusing on the coronavirus pandemic, the UN is warning on this World AIDS Day that the fight against COVID-19 is seriously impeding global efforts of ending the disease by 2030. And those affected are still subjected to stigma and discrimination.
Frank Scherp is HIV positive, but with the treatment available today, he can lead a healthy life. Nevertheless, his diagnosis in 2016 came as a shock.
My only thought was I'm going to die. Even though HIV is all around us, I never thought I would be affected.
Frank Scherp's thoughts no longer revolve around death. Today's medication keeps him healthy, but he suffers from the stigma of prejudice and exclusion. In the 1970s, a virus was discovered which is thought to have been transmitted from monkeys to humans. Over time, it attacks and destroys the immune system. Panic spread across the world, fueled by the lack of AIDS awareness. In 1991, Queen's lead singer Freddie Mercury died of AIDS. A year later, a tribute concert watched by some 70 million people worldwide was held in London. It was then that the New York-based Visual AIDS Artists Caucus made the red ribbon the universal symbol of awareness. Rat und Tat, German for Advice and Action, is the name of this drop-in support center run by the German AIDS Service Organization. Frank Scherp got counseling here after his positive HIV test. Yet even today, the organization's counselors hear many stories about discrimination.
People lose their jobs because the name of a doctor known to specialize in HIV is on their medical certificate. They get asked, "Why are you going to that doctor?" And they get fired.
Frank Scherp pays regular visits to his doctor, so the effectiveness of his medication can be monitored. Thanks to medical advancements, people with HIV can now lead normal lives.
Of the people who are diagnosed these days and receive antiretroviral therapy, that is HIV treatment, over 95% have a viral load below the detection limit. When the load is at an undetectable level, they can't transmit it to another person. I don't think people are generally aware of this. Even doctors who work in hospitals. There's a lot of discrimination against people with HIV in the healthcare system, too.
Betroffene diskriminiert werden, auch im Gesundheitswesen.
Frank Scherp wants to help fight prejudice and educate people. He also founded a self-help group. No one should be afraid of people who are HIV positive, because with the kind of treatment that he receives, transmitting the virus to others is impossible. You can live a normal life with HIV, just like Frank Scherp.
Earlier, I spoke to Nigel Garrett, head of vaccines and pathogenesis research at the Center for the AIDS Program of Research in South Africa, and I asked him if he agreed with Anthony Fauci, the U.S. top infectious disease expert, who says that the pandemic has diverted scientific and financial resources from the fight against AIDS.
Yeah, I think that's certainly true, Chris. We've seen it in our setting where I work in KwaZulu-Natal, in South Africa, where the number of tests being done on people has reduced dramatically by about 50%. About half the people were only started on antiretroviral treatment, which is obviously vital for survival if you have HIV. And then also on the research front, most of the research funding was now channeled into COVID research and obviously accelerating the vaccine pipeline in for SARS-CoV-2. So I think overall, basically the attention of all policymakers has shifted to some degree to COVID. But I think we're also learning a lot about, obviously, vaccines and possibilities that we can back translate to HIV, hopefully once we've got this pandemic under control.
Now, several case reports suggest that some virus variants, including Omicron that everybody's talking about now, may have evolved in immunocompromised people, potentially HIV patients. Can you explain why?
Yeah, so there have been 2 or 3 case reports, one in the UK where they followed someone who was on chemotherapy and severely immunocompromised. And they just found persistent shedding of the virus, which then means that the immune response is still there, but it's not able to clear the virus, which then allows the virus to mutate in a single human being. And a similar case was also found in South Africa in an HIV positive patient who had a very low immune system, not on antiretroviral treatment. And they found that this particular person developed 3 or 4 mutations over a certain amount of months, so probably about a year. So one hypothesis is that this is kind of what they call a reservoir for variant evolution. And I think we need to do a lot more research.
Which larger implications would this then have if there was a link between the Omicron variant and HIV patients or immunocompromised patients?
Yeah, I think basically we need to push vaccinations to everyone. And in a lot of countries now, the US, UK, and I think Germany as well have implemented a 3rd booster dose for as part of the primary vaccination dose for immunocompromised patients. So I think that's crucial that we keep pushing vaccinations. And then obviously for HIV specifically, we need to ensure that we test as many people as possible and start people on treatment to improve their immune system so that we can avoid this phenomenon from happening.
Why is HIV so much harder to fight than COVID-19?
Well, it's a very different virus. So there are many reasons. Some of them are biological, of course, and then some of them are maybe more behavioral. So HIV is a chronic infection. Once you're infected, it stays with you. So often people are what we call asymptomatic and they don't know that they're infected and then continue to infect, especially if they're not on treatment and suppressed in terms of their viral load. And then also there are some more structural issues like stigma and discrimination still. HIV is a predominantly sexually transmitted infection. So surrounding that, you get a lot of stigma evolving. And then obviously that does not help in terms of the prevention effort and also the treatment effort.
And Nigel, if we focus on the medical aspect here, we spoke back in June, and what has changed since then? Where does the field stand today regarding a potential vaccination against HIV?
Yeah, so we had some exciting new findings. I think I mentioned it in June, the Imbokodo trial, which was the Ad26, so that's the Johnson & Johnson platform that's also used in COVID. They developed a mosaic vaccine. We have now got the results of that. It showed a 25% reduction in HIV transmissions. Unfortunately, not enough of an effect to show statistical significance, but enough to do correlate analyses. So we will be looking at what potentially protected some of the population. So that was one, and then there's a larger trial that is still ongoing in the US and South America in MSM, so men who have sex with men and transgender people. And we're hoping to learn more about this concept. And then also the AMP study, so this antibody-mediated prevention trial, was also presented this year and found that these antibodies, protein-neutralizing antibodies, essentially can prevent infection with a sensitive virus, but not a resistant virus. So that is where we are now heading with the field in terms of giving combination antibodies for prevention.
Nigel Garrett of the Center for the AIDS Program of Research in South Africa, or CAPRISA. Nigel, thank you.
Thank you. Thanks for having me.
The newly detected coronavirus variant is also the topic of one of your questions for our science correspondent, Derek Williams.
What do we know so far about the Omicron variant?
Both a lot and still very little. A lot because we already know a lot about SARS-CoV-2. And although this variant has a long list of mutations compared to earlier versions of the virus, experts keep emphasizing that it isn't a completely different pathogen. It's the old one with some new characteristics. And there are three characteristics in particular that are really interesting for us. First is, does it spread faster than other variants? Second is, does it make you sicker than other variants? And third is, can it get around your immune defenses easily, even if you've been vaccinated or recovered? It'll take weeks to accumulate enough data to move beyond speculation for any of those three questions. But some early indicators are leading some scientists to make educated guesses. For example, early data from the variant spread in South Africa, where Omicron was initially identified, indicates that it could indeed be pretty transmissible, though just how it stacks up to Delta, for instance, remains to be seen. If it is, though, the reasons will lie in its genetic code. Scientists have detected dozens of new mutations in the RNA that encodes for Omicron's spike protein, which is shown in pink in this picture. It's the key that the virus uses to break into cells. So if the new variant does prove highly transmissible, the reason will likely lie there. Other mutations have led some researchers to think that Omicron could also be better at getting around immunity. So this might end up being the first variant where we have to tailor messenger RNA vaccines, but we'll only know that in a couple of weeks. On the positive side, a few doctors in South Africa have said that patient symptoms in outbreaks there have remained mostly mild, especially in people who were vaccinated. But that's just anecdotal evidence from a country with a young population, and only studies that are racing ahead now will provide more hard data on whether or not the variant actually is more or less deadly. So watch this space. I'm sure I'm going to be talking about Omicron plenty in the weeks to come.
That's our show. Thanks for watching. Stay safe.